I want to thank Mark for the technical support that he's been so ably providing to us so we don't mess this thing up. I'm joined here in our office with Meredith Ponder and Anna Kovacs, who you'll hear from later. And we've had a great response to this webinar, which we are very happy to see. Our focus today is going to be on elder justice advocacy, all directed toward one goal: getting the Congress to approve the $25 million request of the President for a new elder justice initiative. We will begin with an information and education portion provided by Assistant Secretary Kathy Greenlee, who I will more formally introduce shortly. Then Andy Capehart will explain the importance of the initiative to Adult Protective Services. Marcy Phillips from our partner organization, National Council on Aging, will talk about their exciting national initiatives around elder justice. We will learn more about what the Elder Justice Coalition has been doing in its advocacy work on Capitol Hill from Meredith and Anna. And we will close with some basic advocacy tips and next steps. But just for brief background, just before the 4th anniversary of the passage of the Elder Justice Act as part of the Affordable Care Act, President Obama, in his fiscal year 2015 budget, requested $25 million for a new elder justice initiative. This is the 4th consecutive budget that the President submitted in which he requested funds to implement the Elder Justice Act. Congress has yet to approve any of these budget requests, but undaunted, the administration, demonstrating its commitment to elder justice, has approved allocations of $8 million over 2 years from the Prevention Fund of the Affordable Care Act for elder justice grants and work toward improved data collection. Let me at this point offer our coalition's thanks and appreciation for the leadership of Secretary Sebelius as she completes her historic term as Secretary of HHS. However, not only is the fiscal year 15 request the largest submitted by the President, we feel it has the best chance of being approved by Congress. The issue of elder abuse has grown in national significance. The national and grassroots advocacy work on elder justice has grown more sustained and sophisticated. We think these are factors that might lead to the first direct appropriations for the Elder Justice Act in fiscal year 2015. And now it's my distinct pleasure to formally introduce Kathy Greenlee, who, as many people know, serves in the dual role of Administrator of the Administration for Community Living and Assistant Secretary for Aging. Kathy Greenlee was appointed by President Obama as Assistant Secretary for Aging at the U.S. Department of Health and Human Services and was confirmed by the Senate in June of 2009. Kathy served as Secretary of Aging in Kansas and before that as the Kansas State Long-Term Care Ombudsman. She also served as General Counsel of the Kansas Insurance Department and served as Chief of Staff and Chief of Operations for then Governor Kathleen Sebelius. She's a graduate of the University of Kansas with a Bachelor of Science degree in Business Administration and a JD in Law. And more importantly, for purposes of our webinar today, she has provided singularly distinct leadership for the administration on the critically important topic of elder justice. We are grateful for the progress that we've made from her leadership and welcome you, Kathy, to the webinar today.
Thank you very much, Bob. It's good to be with you all this afternoon. I can see that people are still joining the call, which is fabulous. I know we have people from all over the country. Bob, if I could just take a couple of minutes and remind people that, or tell them, the first time I ever heard about the Elder Justice Act was from you. I was Secretary of Aging in Kansas and attending a Nashua meeting. That's before they reorganized. And Bob came and did a presentation to us. And work in this field made so much sense to me that I couldn't believe it took the coalition 10 years to get this law passed. So hats off to you. I always wondered kind of what's the problem? This is so obvious a need that we need to address. So thanks to Bob for his leadership and also to the broader coalition that has stuck with this for so very long. I know some of those key partners are helping with this webinar today, N4A for hosting it, National Council on Aging, NAPSA, and many others around the country that we really need to rely on right now as we try to fund the program. And Bob, thanks for mentioning also Secretary Sebelius and her support. She is herself a supporter of this issue and has been personally supportive of my work, has known this is a deep commitment of mine and has been there for us within the administration as we've advanced policy changes, the work of the Coordinating Council, and then this budget proposal. So I feel like you all have been working on this for well over a decade, and I showed up several years ago to join you in this work and have said that it's a tremendous honor to serve in both of the roles that I have. And I simply know I can't leave this work someday and leave this work undone in terms of elder abuse. So we have an important function and mission right now, and I'm just determined that we have to get this money funded. So what I want to talk to you about, I want to go through the $25 million initiative that Bob mentioned that's in the President's fiscal year 15 budget for ACL, and tell you from the outset that I'm committed to doing everything I can to get this money, to making appearances on the Hill, to traveling around the nation, to lining up new stakeholders and advocates to talk about the needs of people and figure out a way to get this money across the finish line. Before I talk specifically about the $25 million, I want to describe my own kind of trajectory and how I talk about the work that we're all doing together. The funding, the $25 million is meant to address, deals with both adult protective services and elder abuse. These issues are complementary, but they're not identical, and I think it's important that those of us in the coalition know that, but certainly that you all know that I understand the difference. The work in the field of elder abuse is much more broad than adult protective services. That's reflected in the budget as we talk about risk factors and screening, the impact that elder abuse has with regard to mortality and morbidity on older adults. In equal measure, adult protective services is also more broad than talking about older adults. And in most parts of the country, APS serves people who are less than 60 or 65. They call them different things, but the purpose is to really help people with disabilities or vulnerable older adults or adults, such as people with mental illness. So I think it's important we be comprehensive in talking about both APS and elder abuse and not assume that they're all just completely synonymous, but we need a broad coalition to move this forward. As I talk about the $25 million, I also want to point out that the Elder Justice Coalition has the details of this proposal on your website. NCOA has it on their website. I think there's other parts of the network that have posted this, so I'm not going to read it, but just summarize it to you. So like I said, let me kick this off. This is a $25 million proposal. $13.8 million of it is proposed to specifically enhance adult protective services. Bob mentioned that we have been working to fund the kind of elder justice issues and APS issues for the last several years, and are dedicating currently about $1.5 million to tackle the issue with regard to lack of data. And all of the money in this $25 million is really meant to help us with data, infrastructure, evidence-based programs. For APS specifically, we would like to fund $2.6 million to continue to develop a national data system for adult protective services. What we've been doing so far is basically going out to all of the states that built their systems and find out what you all are doing, what you're gathering, and how we can build a federal infrastructure that interfaces with 50 different programs and find a common way to collect information about the profile of people who need service, but also the outcomes and the effective way that we're providing that service. So $2.5 million to work at the federal level to create the data system. And then we need a way for states to be able to connect with that data system because, again, we're talking about states that have existing programs. So we would fund $5 million of state demonstration grants to give states the opportunity to interface with a new national database so we can start trying to figure out how to build a national system. I also know that it's very important that we create national program standards for adult protective services, and so $5 million of this money would go for the development of standards. 2 weeks ago, I went to Sacramento and met specifically with APS workers who represent the 58 counties in California where the APS programs are housed. And those of you who work in this field know as well as we do at the federal level that we need standards. The kinds of questions and the kinds of issues that were raised to me were things as simple as, how many cases should we have? How do we come up with a common way of describing how we dispose of cases? How do we come up with common standards for training? Some of the most basic aspects of building program standards. That's what we would do with $5 million. And we also need to then, as we build a national infrastructure, put together program evaluation alongside. So $1.2 million would be invested in building a way to evaluate an APS system so we can figure out what works so that we can replicate best practices and demonstrate really the value of the investment. So that's the 13.8. It's all specifically for adult protective services. The other 11.2 looks specifically at the issue of elder abuse, neglect, and exploitation. The first $1.2 million is meant to help support what we need to do in terms of healthcare screening to detect elder abuse. In 2012, the U.S. Preventive Services Task Force found that we need evidence really of all kinds to improve the research for screening older adults and vulnerable adults. I mean, we all talk about colloquially because we know that older adults go to doctors a lot. You know, this is a huge resource for us in the nation, the interface with the healthcare system, but we don't have a tool for medical professionals to use that can be validated as a way to screen for elder abuse. So $1.2 million would be to create such a tool that doctors can use. And then the other $10 million that's left in the program is for basic foundational research on what is known about the risk factors for people, the protective factors, and everything that we need to know to build an evidence base to prevent and detect and respond to elder abuse, neglect, and exploitation. That's the whole package then of the $25 million. The money was put together really as a reflection of the work that you all did when you worked for 10 years as a coalition to pass the Elder Justice Act. And I know that the authorizing language far exceeds the $25 million in the budget, but this is the down payment on the future infrastructure that we need in order to grow. So I wanted to then share with you sort of my thoughts on the most effective way to approach securing this particular amount of money. And the most important thing to me from the beginning is that we all hang together. The broad Elder Justice Act contemplated other dollars that we need. It contemplated dollars for forensic centers, which are fabulous, for programs to support the ombudsman, for background checks, for direct service dollars to states. All of those things need to be funded. But it's really important that as a network we see that we have to start with the fundamentals. And to me the fundamentals are research and data. And that if we can make the case on research and data, we will have more of the information that we need, more of the argument we need to move forward on the other pieces. So we have to pass this first part. If we don't pass $25 million, we can never get to the full appropriation that we need. So we have to hang together, focus on the 25, not compete upon ourselves, not try to reprioritize, but stand solidly and say research and data are worth it, and this is the right place to start. The second, I think, advice that I would pass along, and this is a result of my own experience working on this proposal within the administration, and a language and kind of line of approach that I've used that I found to be successful. We cannot talk about this as being something that's underfunded. The entire Older Americans Act is underfunded. A lot of the programs for aging services that we love are underfunded. What we're talking about here and what we're trying to do is fundamentally different. We're talking about a national infrastructure that was never built. And I think that's a far cry different conversation to say, do you know, nation, we have no federal infrastructure, no federal office, no federal standards, no federal database. It's not that we have things that are underfunded. We don't have things. And when I talked to the APS workers in Sacramento, I felt like that to them that would be a helpful way to describe this as they were doing their own advocacy in the state. We're trying to prove a void, and that can be very, very difficult to do because people will assume since we have both child protective services and adult protective services, we must have similar programs or similar structures, and we simply don't. This is the only time in my career working in the field of aging where I have found it helpful and necessary to compare what we have for adults with what we have for children. I've never found any other case where this was helpful. But the child protective service system that we have in this country is so comprehensive and so much what we need to look to as a model that in this case I think it's helpful. So everything that you can do to talk about the fact that we have direct service dollars for CPS, we have standards for CPS, we have training for CPS, direct program dollars to states, that we don't have in APS, I think, can be helpful. The other piece of advice, I think, in passing along is to remind all of us who do this work that victims themselves are the most powerful messengers. When I was at the American Society on Aging conference in San Diego, I've spent a lot of time in California. I was in San Diego in March. I asked Paul Greenwood, who's one of the best prosecutors in the nation on this, I asked him to pull together some victims so that I could talk to them directly. And, you know, and I'm among the converted. I don't need more motivation, but it's sobering to sit and talk to victims again. All of the victims I met with that day had been victims of financial exploitation. And it reminds us again of the devastation, the loss of security, financial security, the emotional abuse that comes with financial exploitation. I know NCOA and the Coalition did a lot of this work leading up to the passage of the Elder Justice Act through the Witness Project. Having policymakers meet with victims could move this issue. So everything that we can do on any level to introduce policymakers to victims is worth it. I'm not interested in exploiting victims. I'm interested in finding a way for them to tell their story directly because it's so moving and compelling, and we're still trying to overcome a nation who doesn't see what's happening, and the rest of us do. So I would just encourage you to remember the victims. Other thing, I'm just very determined we have to stop and do this right now, tomorrow, this week. I mean, we're working on an appropriation cycle where this can't wait till fall, this can't wait till summer. We have to do this right now. And I think I will state the obvious. We're in the 6th year of an 8-year administration. It will not get easier. And I had been saying this last month. People will start to leave. So we have to do this while we have the advocates that we need, both inside and those of you on the outside, to help us work to get this passed. We need new friends. You all built a broad coalition. I've looked through your list of coalitions. When I talked to Bob last month when we were both in San Diego, I said, you know, who's missing? He said, you know, we really never got law enforcement to support us in the way that we need. At the federal level, we have tremendous support with the Department of Justice, but we need law enforcement. We need the financial services industry. We have good support. I know many of you were on the call with the Consumer Financial Protection Bureau. We need financial services to show up. And we need this to be bipartisan. I am willing to work with Republicans and Democrats, House and Senate, on this issue. I'm willing to talk to anyone. This is not a partisan issue. This is an issue that's important to states. And everyone in Congress comes from a state, and this is about state infrastructure. This is about sending things out to states and building systems for states, for the people who live in states. I think we're making progress. I mean, I can tell since I joined you all in this work several years ago that it comes back to me. No one has ever told me they're not interested. A lot of people don't know what to do to help. No one has told me that they're for elder abuse. They simply don't know that this is a problem. And I can see us making a difference. I see it in the webinars. I see it in the newsletters. I see it in the people picking this up independently to work locally on this issue. So I just want to thank you. I can tell that we're all kind of raising visibility. I think that's a complete win at this point. And what we need is momentum in a direction, and the $25 million gives us a focal point to move in a direction that could really make a difference. So thank you all for everything that you're doing. Let me know of anything you know that I can do to help, because I'm here, and this is a core commitment. Bob, I want to kick it back to you.
Kathy, thank you very much for those important comments, and especially the 3 pieces of advice, which I think come at a very important time in our advocacy work, so that we are singing the same message, because message synchronization is very important in advocacy, as everybody knows. And I just want to remind folks that if you have questions, I believe the Assistant Secretary is going to be leaving us, but if there are questions, we'll discuss them later and work with her on getting answers that may be directed to her. So let me now.
I'm going to sign off. Good luck to you all. We'll be in touch.
Thank you, Kathy.
All right. Thanks, Bob.
We now turn the program over to a good colleague, Andy Capehart, Assistant Director for the National Adult Protective Services Association. And for those of you who know the history of this coalition and this issue, NAPSA is a founding member of the Elder Justice Coalition, has been actively involved in all facets of our work, done tremendous work at the state and national level, and Andy in particular has been doing a great job for NAPSA. So Andy, I turn it over to you.
Thank you, Bob. I appreciate that compliment, and thanks for the opportunity and the invitation to speak today about something we feel is very important. Just a quick note about NAPSA. We're a 501c3 organization, and our mission is to strengthen adult protective services programs in order to improve the safety and independence of older adults and adults with disabilities who are victims of abuse, neglect, self-neglect, and financial exploitation. And we have over 600 members, and those members are in all 50 states. We're also the recipient of several federal grants that address the issue of elder abuse. One of those grants being from the U.S. Administration on Aging. So research tells us that 10% of persons 60 and older are abused every year. This means that of the 10,000 people every day who are turning 65, 1,000 of them have been, or will likely be victims of elder abuse, which is a pretty frightening statistic in my mind. Despite this staggering fact, older victims and adult victims with disabilities are the only victims of crime and abuse who've received absolutely zero designated federal support for services. This is true even though federal support and attention to other types of abuse have been successful, resulting in, as an example, reduced incidences of both child abuse and domestic violence homicides. Similar success can eventually be achieved if the Elder Justice Act is funded, starting with the EJA's very modest funding request that Kathy Greenlee just outlined for us. And this will begin the development of a national infrastructure for adult protective services, which we do not have right now. Elder abuse causes great physical and emotional suffering, obviously, and results in greatly increased rates of hospitalization and premature death. It's also extremely expensive to the victims and their families, to financial institutions, and to the taxpayers. There are many older persons, for example, who must rely on Medicaid to pay for their long-term care after all of their funds have been stolen from them by a perpetrator. APS programs comprise the only victim services system in place in every community, actually in every county, to go into the homes of these vulnerable adults to protect them from further abuse. Without federal support and leadership, APS programs have evolved independently in every state, meaning that the training, the standards, the eligibility thresholds, and the resources available can differ wildly from state to state, and even from county to county in certain states. There are no national definitions. There's no caseload standards. There's no data systems in place right now or other basic prerequisites of any other well-developed social service program. It should probably be noted that APS in 34 states received funding from the Federal Social Service Block Grant, which is constantly under threat of elimination, wherein each state decides how to allocate this funding among its varied social service programs. And in a recent poll conducted by NAPSA, 71% of the respondents in states which rely on social service block grant funds for APS stated that the loss of the funding would be either a significant blow to or would completely eliminate their APS programs. Although it is sometimes stated that SSBG funds duplicate other types of federal funding, that is clearly not the case with Adult Protective Services, which receives no other federal monies. So SSBG funds are essential to maintaining APS services to adult victims in every state, and the additional APS-specific funding through the Elder Justice Act is critically needed to bring all APS programs up to minimum standards nationwide. One resource that NAPSA would like to make available to everyone, and I believe Meredith and Bob are going to put this up on the screen a little bit later, is our website, or a page on our website rather. The website is www.napsa-now.org/cases. This page provides typical examples of APS cases, which could be really helpful when advocating for the need for the Elder Justice Act. We urge everyone listening right now to use these stories, quote unquote, to illustrate the need for funding for the Act. Elder abuse really is gaining more and more attention every day. I started in this field in 1999, and at that time I was really shocked at how little attention the issue actually receives. And in the 15 brief years that I've worked in the field, I've seen a real dramatic increase in news reports and really just general public awareness of our issue. So there's really no time like now to advocate for change, and we can't have change without funding. So thanks so much for your time.
Thank you very much, Andy. Appreciate the insights and direction. And now I'd like to turn it over to Marcy Phillips, the Director of Public Policy and Advocacy for the National Council on Aging, and someone who has worked this issue very hard, very effectively for any number of years now. We appreciate Marcy at NCOA's support. So, Marcy?
Thanks, Bob, and thank you for this opportunity. NCOA has been a proud member of the Elder Justice Coalition for a number of years, and when we had the opportunity to launch a video advocacy campaign that Secretary Greenlee referred to in her remarks in support of passing the Elder Justice Act, we turned to Bob for guidance on our best congressional delegations to target. We created what was called the Elder Justice Now campaign with Witness, a pioneering group of video advocacy, and trained 17 elder rights advocates from across the nation, many of whom were APS workers, on how to use video to give voice to the silent crisis of elder abuse and urge Congress to finally pass the Elder Justice Act. We always intended to honor those who contributed the over 150 stories to the campaign by finding ways to continue to leverage their voices to educate and advocate. Copies of the documentary we created, An Age for Justice, as well as the screening guide for the video, are still requested by local communities to raise awareness about elder abuse and prevention efforts. Since this campaign, NCOA has been focusing on issues of financial exploitation, particularly as we've been testing local approaches to strengthening seniors' economic security. We advocated for the creation of the Office of Older Americans at the Consumer Financial Protection Bureau, and we are pleased to have continuing opportunities to work with them as they develop tools and resources to empower older adults to manage their finances wisely. We've also developed the Savvy Saving Seniors Toolkit to help professionals work with seniors to enhance their money management skills with modules on learning how to budget, avoid scams, apply for benefits, and manage prepaid debit cards. We never imagined that the stories that we collected for the Elder Justice Now campaign, as well as the stories we and every other advocate working on this issue have encountered, that they would continue to find life as we fight to finally get the Elder Justice Act funded. We strongly support the administration's request for $25 million for the Elder Justice Initiative, and we are pleased to partner with our colleagues at the Elder Justice Coalition to call upon Congress to appropriate these long overdue resources. As we've collected stories of elder abuse, neglect, and exploitation from seniors themselves, it's clear that there are committed APS workers, ombudsmen, legal services professionals, law enforcement officials, prosecutors, judges, and aging services providers who continue to fight to prevent and respond to abuse despite the lack of resources or coordinated national strategy. The way Secretary Greenlee describes this initial investment in the Elder Justice Act as a down payment really resonates. It's so important to strengthen the APS network that is on the front lines of this crisis with better data, unified standards, and evaluation that will quantify the effectiveness of the work done every day. Research of potential screening methods and risk factors will also raise the visibility of the silent epidemic and identification of evidence-based interventions should help attract increased overdue investment in elder abuse prevention and remediation. Yes, the heart-tugging stories that are sadly prevalent in every state and every congressional district are still important to influence federal appropriations. But in today's challenging budget environment, it's also crucial to highlight that taxpayer dollars will be used on quality evidence-based programs. As you learn next from Meredith and Anna about the Coalition's advocacy efforts on behalf of the administration's request and how you can help expand our collective reach and impact, I hope you will add the resources at ncoa.org/elderabuse to your arsenal. Thanks.
Thank you very much, Marcy, and appreciate your contributions to our webinar. And now it's my pleasure to introduce together actually, Meredith Ponder, who is the Federal Policy and Media Coordinator for the Elder Justice Coalition and the person that many of you work day-to-day with on the Coalition's work, and Anna Kovacs, who we've been delighted to have as a policy intern for the Elder Justice Coalition for the past couple of months from New York, and they're going to share their the work they've been doing on behalf of the coalition up on Capitol Hill. So, Meredith?
Hi, it's Anna Kovacs. I'm going to start off and briefly run through some of our advocacy efforts. The coalition has been working steadily on behalf of the President's 25 Million Elder Justice Initiative. The Elder Justice Coalition has worked closely with Representative Peter King's office as well as Senator Richard Blumenthal's office to create support on the Hill for the initiative. On April 4th, Representative Peter King and Senator Richard Blumenthal sent dear colleague letters to the House and Senate Appropriations Labor HHS subcommittees on behalf of the Elder Justice Initiative and other elder abuse prevention programs. 14 senators signed Senator Blumenthal's letter, and 10 representatives signed Representative King's letter. The dear colleague letters are available to view on the Elder Justice Coalition website under the blog section. In addition, coalition members have joined us at several meetings with the House and Senate Appropriations Labor HHS subcommittee staff, and will continue those meetings with various offices on the Hill through the next couple of weeks. Meredith?
In late March, Bob testified in support of the initiative before the House Appropriations Subcommittee at the public witness hearing. Following his testimony, we sent a letter to Secretary Sebelius urging her to strongly support the initiative, and we CC'd key people within HHS. And last Monday, Bob had a meeting with Norris Cochran, who is the Deputy Assistant Secretary for the Budget, and Caitlin Miller, who is the Branch Chief, Public Health and Social Services from within HHS, to reiterate our strong desire to have HHS make the initiative a top priority when they communicate on behalf of the budget with Congress. And Bob got a very encouraging response during the meeting. And we hope to schedule another meeting with the Office of Management and Budget, OMB, to continue to advocate for this funding.
The coalition also started a petition on whitehouse.gov to encourage the President to make the Elder Justice Initiative a priority when communicating with Congress. The petition currently has about 400 signatures, but needs 100,000 by May 7th in order for the President to issue an official response. We encourage you to sign on and forward the petition to your friends and others. You can find the link on our resources page slide. We also have updated the EJC website to include an advocacy letter that you could email to your representative or senator to encourage them to support the Elder Justice Initiative. This can also be found on the NCOA website. You can find the link to both letters on the resource page slide.
And I just put up the resource page slide, which we will leave up for the rest of the webinar.
Thank you, Meredith and Anna. And a couple of comments, and then we're going to entertain your questions or comments of your own. First of all, I want to go back to comments made by the Assistant Secretary, and I think it's important that we recognize that for this to be a successful outcome, it is all of us working together with both Congress and the administration. The administration obviously has taken the important first step of proposing the Elder Justice Initiative in their budget, but they have a lot of priorities in the President's budget, and you have to make the case both to them and to the Congress about the elder justice being a top priority among priorities. And I think that message has been done well so far by our coalition. I also think that the Elder Justice Act is a multifaceted piece of legislation, as many of you know. But when it comes to the funding piece, you have to start someplace, and if you make that first step, momentum will allow you to pick up the remaining important elements of the act that should get funded and that we are dedicated to seeing get funded. And then thirdly, I think the last point about victims was very important, and I think that what we need to do as a coalition is spend more time working with our colleagues who have information on victims and learn from victims who can make very powerful statements as advocates. And I think we need to incorporate that more into our work going forward. So folks that have the ability to help us in that front would be most appreciated. And then, on the whole issue of advocacy, and again, advocacy is about being a resource to those who are elected or appointed, in our case in Washington, but also to the media, because without the media's interest in elder abuse, we wouldn't be as far as we are today. We note with with regret, as we did in the statement we issued upon his passing, that the legendary actor Mickey Rooney, who gave many, many important performances in his life that entertained people, may have given one that sobered many people in this country when he came forward as a victim of elder financial abuse and testified before the Senate Special Committee on Aging and opened America's eyes to the growing problem that 1 out of every 10 people over the age of 60 confront. But we have a responsibility as advocates to have information to disseminate, to do it in a constructive way, in a bipartisan way to both sides in the House and the Senate. But as Kathy also said, we should never forget that we are the voice of those who are vulnerable. If our work leads to one less victim of elder abuse, then we have done a very important thing. And if we are the voice of the person who has been a victim of elder abuse and we are making the case on their behalf, that's very powerful advocacy, something that everybody can feel very good about being associated with. Advocacy is about building coalitions such as the ones that we have, expanding our scope of friends, as Kathy alluded to, and we are committed to trying to do that. But we also have to be prepared for opposition. And even though it's hard to imagine somebody being opposed to elder abuse prevention, there are people who are, maybe not so much because they're opposed to elder abuse prevention, but because they're opposed to new expending of dollars, because they are unfamiliar with the issue, because some people are even denial that the issue even exists. Our job is to educate, and we should never forget. We've been at this for 10 years, as was alluded to. In those 10 years, a whole bunch of people were elected to the Congress who come with no history about any issues. They come newly elected. They need to be educated so they can become supporters of elder abuse prevention. That's our job. That's our job here in Washington. That's your job back at home. So as a community, we need to have the grassroots activated. This webinar is called Action and Advocacy from the Grassroots Up. All politics are local. Advocacy is local. We need folks to engage in visits with their elected members of the Congress and their district offices, just as we're visiting them here in Washington. If they hear the same message locally and here, it's going to resonate. We need to have forums conducted. Bring this topic to the forefront. Get the media to come. Get some attention focused on it. We need email campaigns and phone campaigns. We need to educate and raise awareness in our communities. We need to have letters written to the editor. Let's talk about May, for example, Older Americans Month. Let's use that opportunity for a strong push on elder abuse prevention and elder justice. Use social media. Meredith is our social media guru here in the Elder Justice Coalition. But if everybody learns, and we can provide the information, how to tweet their member of Congress. If everybody tweeted their member of Congress at least once during the month of May saying, support the Elder Justice Initiative, that'd be huge in terms of making a difference. And every device you can think of, we need to have done as we go forward. And we pledge to give you all the information that you need, the tools that you need. The resource page that is in front of you tells you how to get more information. We believe our website is a good source of information. And we encourage you to join us in this effort. The success we've had has only been because of the hard work that's been done by thousands of people across the country. But as you know, the work's not over until the President is in the Rose Garden signing a bill that includes his $25 million for the Elder Justice Initiative. That's a ceremony we all want to be part of, but unless we all work at it, we may not see it. So let's continue to work on this going forward. So now let's see what the questions folks have and thoughts that people might have.
If you have questions, please type them into the chat box and we can go ahead and answer those.
Somebody's asked the question of how can we get a copy of this webinar?
It will be available on the Elder Justice Coalition website. This webinar is being recorded, and we will also be putting up all of the links on the website as well. Most of the links are already there in various places, but we will put this slide up specifically. We will probably link it both from the news and updates page and from our blog. And to the question about will the webinar content be made available offline to print or save and to share, the answer is the resource slide that you're looking at is the best way to get that additional information about the webinar content. Is there anything being done about stopping all of the illegal guardianships? That's a difficult question. That's been one that's been focused on quite a bit in recent years. But the reality of it is that guardianship is primarily a state issue relative to the issue of regulation and avoiding inappropriate types of guardianships. There isn't a lot going on necessarily yet, although there are great resources. The National Guardianship Association is a good resource to go to. The American Bar Association, Commission on Law and the Elderly have some work in that area as well. So I would refer you to them. We will post any legislation that occurs on guardianships, but you should be looking at this as a state issue as much as a federal issue. Will advocacy around World Elder Abuse Awareness Day, I just lost a question, hang on a second, be good timing in the appropriations process? Yes, for those who know about World Elder Abuse Awareness Day, it is June the 15th of each year. We are planning on doing another congressional event this year during the week preceding the World Elder Abuse Awareness Day. We intend to do media activities around World Elder Abuse Awareness Day. I'm sure that the administration, through Kathy and others, will be doing some activities in World Elder Abuse Awareness Day. But I think the most important thing that we can do, if we can focus and raise the profile of the issue during May, which is Older Americans Month, and then move it into June as well, the timing could be very good, because it's conceivable that some activity will go on in the House and Senate Appropriations Committee during that time that would set the framework for whether or not this $25 million goes forward. So that's a good point. And to the question about these questions are actually both very similar. Specific literature on working with law enforcement and any resources to educate police and prosecutors on how to recognize, investigate, and prosecute cases of elder abuse. Yeah, I think what we'll do on that question, because it's a little more precise than we might be able to answer, there certainly are resources out there. We have relied over the years on the great work that some individual prosecutors have done in this area. Kathy mentioned Paul Greenwood as one. Liz Lowy up in New York, who helped prosecute the Brooke Astor case, is another individual. I think for the individual who asked that question, we'll try to connect you to those individuals and get some more precise answers on that. But I think the Elder Justice Act, sadly at one point had some very important provisions that would give resources to communities to step up their ability to prosecute elder abuse cases. But that didn't make it into the final Elder Justice Act, although there are efforts being made through Congressman Peter King and others to get that bill passed a second time so we can get that support done for elder justice. Would both of you who asked that question email me? I'm Meredith, MEREDITH, at elderjusticecoalition.com, and we can get you some literature. We talked about the question, you mentioned something about the Elder Justice Initiative funds being funneled through states. Can you expand on how that works and what options states have or don't have? And you're just individuals in Illinois. Well, let me refer you to both our Elder Justice website and the National Council on Aging, as well as AOA, Administration on Aging website, for the explanation of the precise provisions of the $25 million in the Elder Justice Initiative. This is not going to be distributed under the traditional formula process that some people are familiar with, like Older Americans Act has done.
They're likely to be very targeted dollars aimed at building the infrastructure, as Kathy mentioned. But I would look to the specifics of the language and also speak to your state APS people and let them help you understand and interpret what possibilities there may be in your state. Several questions about are there particular legislators in states that are more important in this effort? The answer to that is yes. The Congress, despite what people get sometimes intimidated by dealing with this large institution called the Congress, well, there's 535 members in the House and the Senate, but in reality, there are probably less than 30 members who are most pivotal at this process, at this juncture in the process. And those are the members who sit on the subcommittee on Labor, Health and Human Services of the House and Senate Appropriations Committees. We have information on their names and their states on our website. We have concentrated our efforts, our visits, to that subcommittee. That was the same subcommittee on the House side that I just testified before a couple of weeks ago in support of the Elder Justice Initiative. But I'll give you 4 names in particular that are pivotal to this process. Congressman Kingston of Georgia, who's the subcommittee chair in the House of Labor HHS, as it's called. Congresswoman Rosa DeLauro from Connecticut, who's a ranking Democratic member on the subcommittee. Senator Tom Harkin from Iowa, who's the chairman of the subcommittee on Labor HHS. And Senator Jerry Moran of Kansas is the ranking Republican member on the subcommittee. So those are 4 names, but the whole list can be provided through our Elder Justice website. How can individuals and organizations who are not current members join the Elder Justice Coalition? Thank you for that question. Go to our website.
There's a form on the website. You can fill it out, and it shoots straight to my email address, and I will add you to the list.
And we're a little different than some coalitions in that we do not charge you to join the coalition, but we ask you to help us later. But we're more important about getting you on board because the more diversity we have in our membership from the different sectors who are involved in this field, the better we look when we go to Capitol Hill and talk about our coalition. Is there another way to submit names supporting the $25 million appropriation? I fear many people will not want to set up an account with whitehouse.gov as is currently required of petition signers. Sure. Let me suggest that anybody who's on this webinar could organize their own petition drive and have it delivered to their member of Congress, urging them to support the Elder Justice Initiative. But my understanding is that this petition process, White House thing, is not all that complicated to do. A lot of advocacy groups have done and utilized this effectively to make a case. So I would prefer, and we would prefer, to have people work with us on getting as many signatures as we can on this whitehouse.gov petition, and let's see where we are after the deadline. And but there's other ways that we'll come back with some suggestions. But right now, our focus is trying to get support for this White House petition. Let's see. We'll be updating our YouTube channel to reflect this $25 million priority.
Yes, we will be updating our YouTube channel. We will have another video on there. We can absolutely do that. Here we go.
Do you think we need to tighten up?
Sorry.
We need to tighten up requirements for people before they can open an adult daycare home and retirement homes. Do you think strict and stringent pre-employment and background checks be imposed, and so on? Well, let me go back. Let me go to the second part of that question first. In the Affordable Care Act, as a part of the Elder Justice section, there was, in fact, a provision authored very ably by former Senator Cole of Wisconsin to allow states to apply for grants to allow criminal background checks to be done for people working in nursing homes and other long-term care facilities. This was based on a pilot project that was done a number of years ago in 7 states, where more than 9,000 people were turned away from employment because of what they found on their background check. Surprisingly, even though the administration has put out 5 different notices to the states inviting them to apply for these grants, less than half the states have applied so far. And we find that a little bit concerning because it was an opportunity to get resources to do these background checks. I think they're important to be done. I think licensing is important, and I think there should be standards across the board in elder care to make sure that the safety of people living in facilities is ensured. And certainly one way to do that is to have criminal background checks. I know that research and data are critical, but those of us who know the numbers of incident elder abuse already exist in great numbers. It seems that asking for more data is a way to stall funds for actual needed services, and the need is nationwide. Well, that question does come up on occasion, and let me answer it this way. And I think Kathy Greenlee is correct. You've got to build the case, and if it's data drives dollars in this environment that we're in. If you have good data and can compile it. Right now, the data we have is anecdotal in nature. It has not been consistent. It has not been all that reliable, frankly. Committing federal resources to a data collection process that is reliable, that is defendable, can help us in our advocacy to go to Congress and ask for money, because we can show that the need has grown. I don't think data collection is it's a solid investment because the return on that could be very good. The kind of data that needs to be collected basically is incidence data, types of abuse that occurred, and I'm aware that Adult Protective Services do collect data as part of their job, but we need to systemize the process from the APS side and anybody else that's involved, Medicaid programs and so on. So we have something to walk in to the Congress with to say we need support for elder abuse prevention. The individual who asked makes the point about the entire aging network needs to be notified about the petition. Yes, we agree. We will re-communicate to all of our colleagues in the aging network, and including our larger coalition, the Leadership Council of Aging Organizations. We will alert them and their 60-some-odd members about the coalition, about the petition, so that we can help increase our numbers, so we can get as close as we can to success. And let's see if there's anything else that we have not had a chance to respond to that have come in. Any other questions people have? Then let's just sort of recap what we covered today. Again, our focus is on a very specific initiative, the $25 million Elder Justice Initiative proposed by President Obama in his budget, a very significant commitment of support in difficult fiscal times. It is recognized by those who put it forward as an important investment in building the infrastructure on elder abuse prevention at the state level. For this to happen, the President's budget only is a request. That is the Congress that must approve his request. That is what we're focusing our efforts on right now. That is what the administration is focusing on right now. The White House petition process, the question is, why are we doing that when they've already requested $25 million? Basically, to do two things. One is for them to understand that we see and appreciate that initiative that the President took in his budget. But as I mentioned before, since there are so many other elements of a President's budget, if we can demonstrate to the White House that a large number of cross-section people in our country support this Elder Justice Initiative, when they go to Congress to make their case about what's most important to them, we want the Elder Justice Initiative to be on that list. So we're using every technique we can to communicate to the administration. Even though they've done the right thing by putting it in their budget, we want to see it through to the very end And if they say it's important to them, that sends its own message to Congress that we can then go in and amplify. So that's why we're using this petition process, and we are hopeful that it can help us ultimately in our advocacy message. But at the end of the day, it really is about all of you who joined us today on this webinar. It's about those you can reach through your work, through your community organizations, through your faith-based organizations, in your own neighborhood. You know, it's all about raising the profile of this issue. You know, a victim of elder abuse is never the same. We should remember that. And if we're in a position to do something to prevent it, to help victims of elder abuse, we should do all we can. The time is now. We are committed to working from our end. We enjoy the work that we do because we know how important it is. But we need all of you to join us out there, and we hope that you can do that. And we want to thank you again for participating. Thank our colleagues at N4A for hosting this platform, and we wish everyone a good rest of the day.